So today I just wanted to go over the posterior hip precautions we typically see associated with our orthopedic surgeries here. So 3 basic precautions. Number 1, patient is not allowed to bend their hip past 90 degrees. Number 2, they are not allowed to cross their affected leg over their unaffected leg. And third one, they're not allowed to turn their hip inward. So no walking pigeon-toed is typically what I tell the patient. As far as doing their self-care activities, what this means is that they can't bend over to do their typical lower body dressing and bathing. So I'm going to go over a few pieces of equipment we have available here at the hospital that you might see in the patient's room, or sometimes the patient will ask you about it. So if people are more familiar with it, they can at least give some instruction. So the first thing we have here is a long-handled sponge. Typically just for patients to be able to bathe, but be able to reach their lower legs and feet without bending over. Just one function. The second thing that we have is a reacher. It does the obvious, like picking items up from the floor, picking things up that are a little bit higher. But the occupational therapy team, typically we're teaching patients to use this to grab the waistband of their scrubs or pants, shorts, put it down over their foot and bring it up to a level that's safe for them to reach without breaking precautions. The third thing we have is a long-handled shoehorn. Most patients know what this is, but this one is actually really good because if a patient's sitting, it actually comes up to knee level, so they don't have to bend at all. And it just helps make sure the back of their shoe doesn't roll under, and then they break their precautions trying to fix it. The last thing that we have is called a sock aid. Now, a lot of patients actually have no idea what this is, and they give you kind of a blank look when you talk about it. But the idea of this is that it has long ropes so that they can put on their socks without bending. You would just slide the sock on this plastic part of it, and then use the ropes to pull it over your foot. So once patients know what it is, they tend to think it's a cool item. It's just, we get a lot of people not knowing what it is. These pieces of equipment are available here at OSF, so if you ever need them or have questions, you can always flag one of us in therapy and we'll be happy to help you.